And our speakers are very dear to our hearts, these next two speakers. So we have Dr. Patricia Watts. Patricia is one of our longest serving art therapists. She's been providing one-to-one art therapy in the Glasgow Children's Hospital for many years. I'm not quite sure how many years, but I think Patricia goes back a very long way with the charity. And we also have Dr. Simon Hackett with us. Simon is one of our trustees on the Board of Trustees. He's also a consultant art psychologist in the NHS, and he's also a senior clinical lecturer at Newcastle University. So we're very lucky to have him on the board. And I know that Patricia and Simon have been working very closely together over the last couple of years, developing a manual for best practice in art therapy. So that's what we're going to have a little chat about now. I can't actually see Simon. I hope he's available and coming up on the screen any minute now, but I can see Patricia, so hello Patricia. So this is oh, here's Simon. Hello Simon. So here's Simon and Patricia. I'm going to hand over to them. Now this session takes us into the lunch break, which is at about 12:20, 12:30. So I don't know how people feel. I'm sure people will have questions for Patricia and Simon on this item, because it's really interesting and really important. So if they're happy to stay on a bit, and if you want to ask questions at the end of this particular session, rather than waiting till the end of the day, as it were, at 2 o'clock, happy to do that. If Patricia and Simon are happy to do that, we'll just see how it goes with questions. So thank you both for coming, and over to you about best practice in art therapy. Thank you.
Okay, so as Simon was saying, we've been working together on the development of a manual looking at best practice in art therapy. So we've had our introductions. I'll just skip straight to the manual and how we went about developing it. So I'll tell you about the approach we took to developing the art therapy group sessions that we've been developing. So it's based on what we've learned from a systematic review that Simon's team carried out at Newcastle University, and he'll tell you a bit about that later if his sound allows it. If not, I'll tell you about it. We considered the views of children and their families that we consulted, and our own experiences from running art therapy groups. So this prompted our interest in developing a children's group with accompanying resources and concurrent sessions for parents and carers to have with their child. And the main aim of the group is to empower children to see themselves as experts in their condition and how it affects them. The group also recognises the expertise of parents and carers in the management of their child's condition, and it was important to have a concurrent group model that promoted partnership working with parents and carers. So this involved creating a set of resources to promote children's resilience, well-being, and to further support the management of the emotional impact of their conditions, which their parents and carers could use at home without the intervention of an art therapist when the group comes to an end. So we're really looking to provide a pack of resources that would last beyond the group. And the target group of children was aged 8 to 11, as this was identified from a previous Teapot Trust service review as the age group where the uptake for art therapy one-to-one sessions and groups was the highest. So move on to the next slide, please, on group art therapy sessions. Sorry, the next slide again. Sorry, I didn't realise we hadn't moved on. So the art therapy group was designed as a block of 6 sessions to cover the common themes that children have brought to one-to-one and group sessions over the years. The groups will be facilitated by art therapists, and the design was based on feedback from children from a previous Teapot Trust group. And it was really important to consider what they had to share particularly as children attending our groups may have limited choice over what happens to them when they attend hospital for their appointments. So we saw this as an opportunity to make children aware that the group is a space where they do have a choice, whether to attend, what snack to have, what to share or not to share, and what to do with their free time. So the group is structured in the same way for every session and involves time for welcoming the children, settling them in, having a warm-up activity, introducing the theme, completing an activity that explores the theme, having a period of free time where the children can play and work on their own art, and then ending with a reflection on the discussions as well as preparing children for the theme of their home session. So I'll now run through the objectives for each group session, which you can see on the slides. So getting to know each other. The idea behind that was to help children to get to know their peers and facilitators, as well as the space or how it's going to work online. And to help children to gain an understanding of the focus and the format of the group, and to help them set their own rules and boundaries for the group and how they want it to work. To help children acknowledge that they are the experts in their own bodies and conditions, and the adults facilitating the group are not the experts, and supporting them to think about their conditions and how it affects them, but most importantly to reduce the isolation that they may feel by facilitating a space where they can be supported by their peers with a shared lived experience. So the next theme of Celebrating Me was in recognition that a lot of children can feel disempowered by their diagnosis, and this session aims to help children to think about their strengths, talents and achievements, and understanding that they're much more than their condition, and to help them to acknowledge the losses and gains associated with their diagnosis, and to help them focus on the things they can do rather than what they're not able to do or what they feel they're not able to do because of their condition. The next theme of Taking Care of My Health, that aims to help children to think further about their own physical and emotional health needs, and to reinforce that they have a range of needs that are not always associated with their condition, and to help them further focus on what their body is telling them, and to recognise emotional and physical cues, and to help them think about emotional and physical self-care, and support them to better communicate their health needs to others, including their parents and carers and health professionals. This leads us on to honest conversations. That was to help children to think further about how they ask questions about their condition and the management of it, and to reinforce to children that they've got a right to ask questions about their condition and how they manage it, and help them to focus on what they can take responsibility for finding out the right information and knowing who to ask, and to help children to think about the importance of honesty when discussing their condition, and to help them identify any barriers to honesty when discussing their condition. The next one, Taking Care of My Feelings. So that's to help children think further about how they identify and share any difficult feelings they might have about their diagnosis. So for example, loss or anger, exclusion, isolation, and to reinforce to children that they have a right to feel a range of difficult emotions related to their condition, and help them to focus on how they can share their feelings, both positive and negative, and to know how to identify those feelings in their body and what their feelings communicate, and to help them think about the importance of taking care of their feelings and their emotional well-being, and knowing who to ask for help with that. And the final one, stepping into my best future, that's to help children think further about their future goals and supporting them with the idea that their diagnosis shouldn't hold them back from what they want to do in future, helping them to think about how they manage their condition, their medical appointments, their medication in future, and helping them to know how to seek help and support if anything changes with their condition or overall health, and helping children to feel empowered about making decisions to work towards their future goals. So I'll move on to the next slide. And that's about the concurrent home support sessions. So these sessions would run in between the group sessions, so there is a bit of an overlap. But these sessions are facilitated by parents and carers at home, and we felt that parents and carers are best placed to offer ongoing emotional support to their child, and they're very much seen as the co-facilitators of this group, working alongside the art therapists to build on the themes that are introduced in the group. And these sessions are designed to empower parents and carers by equipping them with the additional tools and resources to offer that emotional support, because we know from the children and families that we've worked with, is that the strongest parent-child relationships can be tested by a child's condition. So the overall aims of involving parents and carers as co-facilitators is to support parents to acknowledge their own expertise in managing their child's condition, to help them have an increased awareness of how the condition affects their child emotionally, and have an increased awareness of their child's triggers, and they're equipped with various ways to offer validation and support to their child. And they're hearing directly from their child what those triggers might be, using the resources as a prompt to have a conversation. It's also to increase the parent carer's confidence in speaking to their child about their condition and offering ongoing emotional support to their child. An increase in parental confidence and supporting the child to share their views at medical appointments and to put their views, their own views as parents across. And to increase their child's resilience and autonomy, to prepare the child for taking over their own management and medication in future in age and stage appropriate ways. And reducing any tensions in family relationships, and managing the condition by opening up that conversation about triggers, and giving, as I said earlier, giving parents and carers a range of tools to further support conversations that they will already be having with their children. But the most important aim of the group is that children and parents and carers are equipped to deal with the emotional impact of their child's diagnosis without ongoing therapeutic intervention. Okay, so we'll go on to the next slide, and I'll hand back to Simon.
Hopefully the sound's working a bit better. No.
Okay. Right, Simon.
Your device on, Simon.
Sorry?
If you're logged into more than one device, that might create that feedback sound.
Okay, I don't think I have, but I'll tell you what, I think I'll just let Patricia carry on. But what I
Yes.
will do is I'll just put the systematic review link.
Okay, thank you, Simon. So last year, Simon's team conducted a systematic review of the published research on arts-based therapies for children and young people with long-term physical health conditions. And Simon's going to share the link, but from the searches of the published research and databases, by using keywords, after they excluded duplications, the team found 3,350 papers. They then screened those papers by looking at the title and abstracts and checked them against the inclusion and exclusion criteria. So after screening them, they were left with 98 full papers that were closer to the specific area that they were looking at, and we did some detailed checking of these papers and got down to 16 research studies on arts-based therapies to help improve mental health in children with long-term conditions. The studies that were included used visual art, music and play therapies with children and young people who had a range of physical conditions, including a number of cancers, leukemia, sickle cell disease, diabetes, epilepsy and asthma, and most of these studies were carried out in America. The studies did show some improvements on indicators of mental health and well-being, including quality of life, coping behaviours, anxiety, self-concept and improved mood. But it was difficult to compare the interventions as they were very different from each other, and the ways of measuring change were not the same or consistent. So we do know that integrating mental and physical health care can be helpful for children who have long-term conditions, because children with long-term physical conditions have an increased risk of having mental health difficulties, and arts-based therapies can be helpful for this. They can be age appropriate, engaging, and help children to articulate their feelings in more creative ways about things affecting them. Arts-based approaches are less reliant upon talking, and they can also give young people things to talk about. And if we want to build upon this and demonstrate that arts-based approaches are helpful, we now know that we need to increase the quality of research that's carried out. We need to include shared outcomes that can be tested out in different studies and compare them to use standardised or manualised approaches like the one I've just spoken about with the development of the art therapy group, so we can replicate the approaches that are tested across different settings. And we need to see if the things that change for young people are positive improvements in their mental health, and also that the things that improve are personal and meaningful to them, and more broadly to see improvements in their well-being and quality of life. So we'll move on to the next slide, please. Oh, yep, that one. So next steps for the group. We run a lot of different kinds of groups, and we've been running individual and group work online during the COVID pandemic when face-to-face groups haven't been possible. Simon and his team have carried out a national survey of art therapy during the COVID pandemic to find out about how digital and online therapies are working. And from that study, they know that online art therapy can be run safely and ethically. And now what we want to do is to do some more work on testing and evaluating the manual for the art therapy group that I described earlier. It's important that we test this out in a more systematic way, and we want to look at a few important areas. And one of the most important things to find out is it acceptable to the children and young people and their parents and carers? And we think the best way to find that out is through doing some short interviews with people after they've completed the group. We want to know how children find the group. Do they like the activities they do? Do they like the way the groups run? We also want to find out about the materials and the instructions for the home sessions, and the practical stuff, like is the timing and the duration okay? So we're asking, do people want to stick with it after they've started? Has it been helpful? We want to collect outcomes before and after the group to see if it helps with young people's mental health, to find out, is there any personal or meaningful change for the young people? And more generally, does their sense of well-being or quality improve? And we've identified measures that will capture this. We're currently applying for research funding to do this, to continue to build on the quality of research evidence in this area. So we hope you've enjoyed this overview, and we're trying to develop best practice in art therapy with children and young people who have long-term physical health conditions. And we think it's a really important area to focus on, and we really hope that our work will progress and have an impact on improving mental health and physical health care in the lives of children, young people and their families. And that brings us to questions, if anyone has any. Thank you.
Thank you very much, Patricia. Just saying hi from Liz here. How do you see the future of the art therapy manual then? I mean, do you see it as evolving over time? Do you see it as coming to a point that you're happy with it and it's been tested and it is disseminated in some way and shared, and then is reviewed on a regular basis? How do you see it sort of actually kind of getting out there into the world of art therapy, as it were?
Yeah. The stage that we're at with the manual is that we're looking to have it peer reviewed by children, young people, their parents, our colleagues in health, and the team that Simon works with as well. So we're also looking to see how we can how we adapt it for online use. So there's a few things that we need to consider first, but before we put it out there. But as I said, we're looking to apply for funding to develop it, and we would want to pilot the group with children and young people and get further feedback on any improvements that need to be made. But yeah, there are lots of plans in the pipeline for how we get it out there.
Brilliant, thank you. Thank you. Do we have Simon back?
I'm back. Simon. It might sound any better.
Yes.
I'm back on a different device. So well done, Patricia, for carrying on that. Much appreciated.
Would you like to add anything, Simon, to what Patricia said now that you're back?
Just this is really exciting. I think it builds, obviously what we want to do is build upon the research that's out there and on practice that we've also heard about today. So we know this is a really important area. And I think what we're trying to do here is to look at this work in a kind of more systematic way and build up steps so that it can be replicated and that we can use standardized outcome measures. Because one of the issues, as Patricia mentioned in the presentation, was that lots of people are doing work on looking at outcomes and benefits of arts therapies and arts-based therapies, but they're not necessarily the same outcome measures. So it's kind of hard to understand amongst a kind of broader group of young people about the benefits. So that's why we're kind of taking a bit more of a systematic and methodical way of piloting this work, which is based upon, you know, the research that's already out there, we've discovered in the systematic review, and obviously the practice and feedback from young people that we've been listening and hearing about today.
Thank you. Thank you very much. Well, that was really interesting. Does anybody have, in the general meeting, does anybody have any questions for Simon and Patricia or Patricia?
Hi, Simon. We've talked before online, which was great. I just wanted to ask you if you found a measure that you think would be a really good one to ask people to start using. You know, if something surfaced that you think that would be the one that would really help us make these comparisons and have us all on the same page, if you like, asking similar questions.
Would you like to answer, Patricia, because Simon's vanished?
There's a pattern here. Oh, you're back. We're currently looking at measures that we use already as part of the one-to-one and group work sessions. So currently we use goal-based outcomes. We use PEDS-QL, which is a standardized measure for looking at children's how they cope with their condition and any changes that arise. But I think we need to sit down and look to see what's going to be the most suitable outcome measure that captures the children's views, the parents' views, and also the art therapists that are running the groups.
Yeah, sorry, I'm back. I'm harassed by technical problems. I'm really sorry, really sorry. Yeah, as Patricia said, I think that, you know, the kind of three areas are, we need some sort of standardized measures. So one is, if we're looking at anxiety and depression, the revised child anxiety and depression scale is one that we've looked at. And the PEDS-QL is another, which I think, did you mention that, Patricia? Yep. And so, yeah, and then capturing that meaningful change that parents and children would identify.
Thank you, Jill. Any other questions from anybody?
Jill, have you got your hand up again?
Yes.
Yeah. Welcome back.
I wondered if you are considering designing your own, you know, like something to put out there into the field of research that will do a really good job, you know, using everything that everybody knows already, and yeah, being in a...
Yes, I think that could be a possibility, and at the Teapot Trust we have spent quite a while looking at various outcome measures that could be suitable for children and young people, and I don't think we would be against developing something bespoke that would capture the outcomes that we want to capture for this group, but that's something that we're still in discussion about.